In India especially, people underuse sunscreen.
I'm choosing the highest number of SPF does not always mean that it's giving me the broadest spectrum.
No, absolutely not. If you're using a mineral sunscreen, you can directly apply it and just step out. The recent sunscreen formulations are so beautiful.
Quick confession before I start. This morning, I went to the market without my sunscreen for like 20 minutes tops. Is that okay?
It's absolutely not okay, and that's what 90% of India is doing right now.
I'm sure I'm not the only one who's confused about sunscreen, when to apply, when not to apply, how much to apply, how much not to apply. And then there's your options like mineral, chemical, hybrid. There's just so much for every skin type. And that's exactly why I have skincare expert Dr. Geetanjali Shetty with me here, who is an expertise in dermatology consultancy, who's going to talk all about skincare and tell me how to own the sun 101 with sun protection. Dr. Shetty, thank you for joining us.
My pleasure.
Let's dive into the conversation and talk about why it actually matters. I really want to ask you, if I'm going out for 15 minutes, does sunscreen really matter for that 15 minutes?
Love this question. Common question. Let me just break it down. There's this common thing about abhi barish hai, should I apply sunscreen? Or I'm just out for 5 minutes, it's just hop to my car, to my office back to the car.
Yeah.
Let me describe you, it's 5 minutes today, it's about 35 minutes a week, and how much is it at the end of the month? It's almost 300 minutes. So you're actually dealing with something called as cumulative sun damage. So every day of 5 minutes really adds on to something very harsh. And the UV index now these days is at the highest. And don't ever think if it's cloud, it's snowing, it's raining, the UV index is low. The sun is shining bright there. It's just that you really have to use the sunscreen all the time, 365 days.
Even when I'm at home.
Actually, there are infrared rays at home which also need sun protection. So yes, even indoors these days do require sunscreen.
So I think the damage is just more than tanning, if I'm not wrong.
Of course, yes. Now you have two types of rays. You have the UVA, which is responsible for aging. These are your fine lines, your wrinkles, your photo damage. And you have your UVB, which is nothing but your burning for your hyperpigmentation, your red spots, your pigmentation, tanning, melasma, and all of this in line.
So doctor, every time I shop for a sunscreen, it gets so confusing because there's SPF 30, SPF 50, we have mineral, chemical, it's just so confusing. And what suits for every skin type? It's so hard to boil it down.
Let me just break it down for you. Let's talk about mineral first. Now, what is mineral? Something that has mineral in it. So minerals are zinc oxide, titanium dioxide. I don't know, when you were small, if you would have seen those cricketers applying those sunscreens, the thick pasty one. Now, those were those old days mineral sunscreen that used to be put on the skin. So these are precisely called as mineral or physical sunscreens. Now, the chemical ones are something that have oxybenzone, ovobenzone, homosalate, and a lot of chemicals in them. Now, the idea of chemical sunscreen is they absorb sun rays and that's how they protect. Now, if you honestly see at both the sunscreens, both protect you against the UVA and the UVB rays. Talking about hybrid sunscreens, which are the latest sunscreens in today's world, is a combination of all three spectrums of light. That's your UVA, which are your aging rays, your UVB, which are your burning rays, and also your infrared rays, which are your latest gadget rays that are coming for you. Such a sunscreen which has filters for all three spectrums is known as a hybrid sunscreen. So now let's assume you're shopping for your sunscreen. It depends on A, your skin type, B, your exposure, your age, your profession, the time that you're staying out in the sun, and your acceptability towards the sunscreen. Depending upon all of that is how you're going to choose your sunscreen.
So talking about mineral sunscreens, is it actually recommended for all skin types, and is it actually good, or is it just another skincare trend?
Honestly, if you pick up certain age groups, certain criteria of people, and in fact most of them, because physical sunscreen these days have become fantastic. I mean, they are micronized, they are easily spreadable, they are well dispersed, they absolutely don't leave white cast like the way I said the old days one. You honestly can't differentiate between a physical sunscreen these days and a chemical sunscreen these days. As far as the protection goes, 100% protection depending upon what filters you're using. If you really talk me about mineral sunscreens, what are the criteria that we're looking when you are writing a mineral sunscreens? Kids, age groups, patient undergoing anti-cancerous treatments, pregnant women, sensitive skin, patients with disrupted barrier, redness, rosacea, acne. All of this go very well with physical sunscreens. At least in my clinic, these are the set of patients that I write physical sunscreens for.
So doctor, if I got it right, do you recommend mineral sunscreen for people with acne-prone skin, oily skin?
Honestly, it goes for all skin types. I mean, these days the mineral sunscreens is so beautiful that you really can't differentiate it. It's cosmetically elegant. It can go on all skin types.
Doctor, mineral sunscreens are often perceived to leave a white cast.
That is what you're talking about is years back, when our cricketers used to apply this thick layer of pasty thing on their face. Gone are those days. The recent sunscreen formulations are so beautiful. They are micronized zinc oxide, titanium oxide. They nicely get dispersed on the skin. The spreadability is beautiful. Cosmetically, they are elegant. And the acceptability rate is very high when it comes on mineral sunscreen because it goes very well even with sensitive skin. So if you honestly ask me, the white cast, gone are those days. And if you ask me about the protection, beautiful protection against both the UVA and the UVB spectrum.
So doctor, from what I've understood till now, is it suitable for people with oily skin? Will it clog pores or something like that?
Absolutely not. In fact, it's micronized to such a level that you actually get it labeled as non-comedogenic. In fact, acne patients, rosacea, they also have a little bit of barrier disruption because of the use of actives. I think mineral sunscreen goes perfectly well with such class of patients as well.
Doctor, confession, I have not in my life once turned the sunscreen bottle and read the ingredients.
So in an alley of a big supermarket or in a busy mall, how do you really pick up your sunscreen? I mean, let me break it down. Let's see how should one buy a sunscreen. There are three main rays. The UVA rays, which is aging, the UVB rays, which is burning, and then you have the infrared rays. A hybrid sunscreen takes care of all the rays. So let's assume it's this young, talented girl like you who's busy shooting in windows, traveling out, adventurous, doing sports. You need something like a hybrid sunscreen because you're also so much on the screen. So what am I looking at? I'm looking at UVA protection in the form of PA 3+ or 4+. For the B, that's the burning rays, I'm looking at a good SPF of more than 30, which is actually the optimum SPF. Anything above 30 is most welcoming for a dermat like me. And for infrared, I'm looking at molecules like iron oxide. A combination of all three with the safe chemical ingredients in a sunscreen actually sums up what you should always look when buying a sunscreen. Also, check in for the formulation depending upon your skin type. So of course, if you're oily, you look for gel. If you are dry, you look for a cream-based. If you're using on the body parts, you look for a lotion-based. So these are small things that you should really be looking the next time you're shopping for sunscreen.
Do you recommend it for patients, the sensitivity they get post-procedures?
See, mineral sunscreens are a take for post-procedures. What's happening during procedure? You're basically disrupting the barrier. The initial few days, the skin is really inflamed, red, sensitive. That's when mineral sunscreens come into action because they are non-irritating. Of course, they are elegantly, cosmetically acceptable, unlike the previous formulations. And because of their non-sensitiveness, this is my take on post-formulating sunscreens.
Doctor, do mineral sunscreens cause hormonal disruption?
Absolutely not. They are one of the most safest formulations that you can freely use, right from 6 months of age in a baby to probably even the pregnancy.
Okay, most of my friends are now opting for mineral sunscreens.
See, it all started with some absurd chemicals in the chemical sunscreens that was pointed out carcinogenic, hormonal disruptor. So that's what I said. If you read your ingredients carefully, you just don't have to be worried about chemical sunscreens. And of course, mineral sunscreens are the safest bet.
And talking about the biggest question, how much sunscreen should we really apply?
Once that now you know what sunscreen to buy, the most important thing is your compliance and how much and when to apply. When you're using a chemical sunscreen, it needs to be applied at least 15 to 20 minutes prior your sun exposure. Because you know why? It takes some time for it to get assimilated into your skin and that's how it starts absorbing the sun rays. However, if you're using a mineral sunscreen, you can directly apply it and just step out. It does not need time because these are titanium dioxide or zinc oxide that just sit on the skin and are physical blockers or mineral sunscreens.
Okay.
Now, if you really ask me how much, that's the biggest question of the century. In India especially, people underuse sunscreen. They don't apply honestly the required amount. 2 fingertips or 1 teaspoonful is ideally the required amount of sunscreen that you actually need for your face, for the dorsum of your hand, a little bit exposed surface of your feet. That's the skin that you're exposing, honestly, if you've covered your other areas. So using it every 2 hours, reapplying it, checking if your sunscreen is sweat resistant, water resistant, and the right amount also matters when you're talking about sunscreen.
So when we talk about mineral sunscreens, do I need to apply it way prior to when I'm leaving the house, and does it need reapplication?
Mineral sunscreens can be applied immediately. Their action starts immediately because they're also known as physical blockers. So the moment you apply, their action starts. So you can just apply and you can reapply during your adventures and between your swimming. It doesn't need time for it to kind of get assimilated in the skin. Gives you 100% broad spectrum protection both against UVA and UVB. In fact, it's a good choice for adventures, for cycle riders, for swimmers, for small kids, for people who are involved in adventure sports.
Doctor, when I personally go and buy sunscreens, I only look at the SPF and the highest number of SPF. That's all I look at. Is that the right way to buy sunscreens?
So honestly, in our books of dermatology, we consider SPF 28, which protects you against UVB rays, as optimal. But the problem comes when you don't apply enough. So sometimes using a higher SPF, and if not the application is done properly, gives you a little more benefit of probably 1 to 2% vice versa in SPF 30. So anything above SPF 30, be it 50, 80 is most welcoming for us.
And how do you differentiate sunscreens? What do you give more importance to, SPF or PA4+?
If you ask me, I need both. I need a good optimal SPF for my UVB protection, and I need an amazing PA4+ for my UVA protection. That's what I call as a broad spectrum good sunscreen.
So you can't just pick one, like it can't be like SPF. If I'm choosing the highest number of SPF, does not always mean that it's giving me the broadest spectrum.
No, absolutely not.
Okay. So doctor, every time me and my friends we talk about sunscreens, I have just so many questions. I'm going to rapidly fire them at you. Should we get into it?
Yes, please.
Are you ready? Okay. Mineral or chemical, what's your pick for sensitive skin?
Mineral?
SPF or PA4+?
Both, I need both.
One ingredient everyone should know.
Zinc oxide?
Biggest sunscreen myth.
मैं तो धूप में जाती नहीं हूँ, बारिश में धूप होती नहीं है. I don't need to reapply. I'm applying enough. There's so many.
One ingredient everyone should check in their sunscreen.
The chemical ingredient list.
I have this really fun segment. Starting with, I want your verdict on a few things. Following the 2-finger rule for applying SPF.
For sure.
Okay. Applying sunscreen with a makeup sponge.
Absolutely absurd. You're missing so many spots.
Using DIY sunscreen recipes.
A big no, 0.
Choosing sunscreen based on UV filters instead of just SPF.
Absolutely wrong. Look for both.
Okay. Using sunscreen powder as the only SPF.
Doesn't work that well. You know, it gets wiped away very easily. Layering, yes, I would go with the powder.
The next segment is sunscreen habit versus problem. Not reapplying the sunscreen around the clock.
Absolutely wrong. Reapplication is what works in giving you full protection.
Not wearing sun protection indoors.
If you're not that exposed to the infrared, I'm still okay, but I would prefer application because of the infrared rays.
Yeah. Only applying sunscreen on face.
What about your other exposed areas? Aren't you worried about getting tan?
Not wearing a sunscreen while on a flight.
High altitudes, high sun rays, high UV index. So please use a sunscreen.
Definitely. And now for the last one, we have this or that sunscreen edition. SPF or PA ratings?
Both.
Okay. Apply once a day or reapply around the clock?
Keep reapplying.
Around the clock.
Of course.
Chemical UV filters or mineral UV filters?
Mineral UV filters, more so if you have a sensitive skin, rosacea, kids, pregnancy, that stretchy, irritated, inflamed skin, mineral filters.
Thank you, Dr. Geetanjali Shetty, for such a lovely session. And one thing I'm taking away today is how to buy the right sunscreen, how to check the SPF correctly, and how to own the sun.
Thank you.
It was a pleasure
lovely
for me
talking
as
to you.
well. Thank you so much.
Now, one thing I really want to tell you is, you're an expert on how to buy a sunscreen, what to look when you're buying a sunscreen, your chemical and physical filters, looking for your iron oxides for your infrared. Please reapply them the way I have taught you. Please reapply the right amount the way I have taught you. Know what to buy for whom, and in the end, Always love the sun if you have the sunscreen on.